Snakebite remain a major public health challenge, especially in rural communities where encounters with snakes are frequent. However, the situation is being worsened by the scarcity and high cost of anti-snake venom, the only effective treatment for snakebite victims. Tasiu, a 9-year-old boy, was brought to the snakebite treatment and research hospital after he was bitten by an unidentified snake on Monday. His guardian, Malam Adamu, narrated the difficulties he faced while trying to bring the child to the facility from neighboring Taraba state. The treatment is very costly. From Philia to this facility, I paid 20,000 naira just to bring him here, not to mention the cost of anti-snake venom vial. It is important for the government to urgently find a sustainable intervention in this regard. According to the patient and caregivers, the price of a single vial of ASV, currently estimated at about 250,000 naira, has made access to treatment extremely difficult. Many say the high cost forces delays that sometimes result in severe complications or even death.
Some of them come back to the hospital after maybe taking some concoction or herbs at home. And when they feel that they cannot treat them, they send them to the hospital. This is number one, because when they come here, they require a lot of things. They need anti-snake venom, and which is not readily available. Also, is a problem.
We were told to buy anti-snake venom for 250,000 naira, which we did, and the expenses are still paying off. How can an ordinary person afford this? Government should help us with free drugs. Health authorities at the Kaltungo facility said efforts are ongoing to address the challenge, expressing hope that local manufacturing of anti-snake venom will provide a long-term and sustainable solution to recurring shortages.
One of the pillars of the establishment of this facility is actually, first of all, started with development of the anti-venom, and of course, leading to production. The plan is actually to reach a level where we can have a production of anti-venom within the country. In fact, most likely within the facility, being a highly burdened area. But you know, these are issues of policy, these are issues of plans which are usually affected by change of governments from time to time. And as such, at this stage that we are, we've actually developed the etiquette anti-venom was actually developed in this facility. And of course, it's currently being produced. The etiquette ICP part is produced in Costa Rica, and also the G part is produced in Britain. And of course, at the level of the facility, we are still on advocacy and looking at the way the federal government and the state government has brought out its attention back to the facility. Now we are seeing light at the end of the tunnel. Standing here at the Snakebite Treatment and Research Hospital, Kaltungo, health workers say the rising cost and limited availability of free anti-snake venom continue to put pressure on both medical personnel and the patient, as many patients from rural communities and neighboring states are coming here without the money to pay for the life-saving drugs.
He says local production will not only reduce cost, but also ensure steady availability of the drug across health centers. Authorities at the hospital revealed that over 1,000 snakebite cases were recorded last year, with 54 deaths largely linked to delayed or inadequate access to anti-snake venom.
The truth is that anti-venom is very, very expensive. And currently a vial costs around 250,000 per vial. And some of those patients may require 2-3. And interestingly, the demographics of those patients are from low socioeconomic class. These are people that have gone to the farm looking for a source of livelihood, that's farming, herding, and all that, and then end up being bitten by snakes. So you can imagine, for them to acquire this money, they have to either lease their farms, lands, or maybe sell some of them, or even sell maybe a car or so before they will come and buy one vial. And talking about that, what if the patient will require 2-3 vials? So it's a very serious matter.
As snakebite incidents continue to affect vulnerable communities, victims and health workers are urging government at all levels to prioritize the provision of free anti-snake venom while fast-tracking plans for local production to save lives and reduce preventable deaths. Hassan Lawan Koli, Trust TV News, Gombe.